is a detailed, point-by-point explanation of the 12 differences between biopsy and autopsy with expanded clarity, examples, and context. Biopsy versus autopsy. Detailed differences. 1. Definition. Biopsy. A biopsy is a medical procedure in which a small piece of tissue or cells is removed from a living person to examine under a microscope. The main goal is to identify abnormal changes or diseases at the cellular level. Autopsy. An autopsy, also called postmortem examination or necropsy, is a systematic medical examination of a dead body. It includes external and internal inspection to determine the cause of death, disease progression, or to collect evidence for legal investigations. 2. Purpose. Biopsy, to diagnose diseases such as cancer, infection, or inflammation. To guide treatment decisions, e.g. chemotherapy, surgery. To check severity or grade of disease. To monitor progression or response to therapy. Autopsy, to determine the exact cause of death. To detect undiagnosed conditions. To evaluate the effectiveness or appropriateness of medical treatment. To gather evidence in medical legal cases, e.g. murder, suspicious death. To help in teaching and research about diseases. 3. Subject. Biopsy. Always performed on living humans or animals. Tissue sample is taken from organs like skin, liver, kidney, breast, bone marrow, etc. Autopsy. Always performed on deceased individuals. Entire body or selected parts may be examined. 4. Scope of examination. Biopsy. Involves a small localized piece of tissue. The sample may be tiny needle-aspirated tissue, a skin punch, or a small surgically removed lump. Autopsy involves examination of the entire body both externally and internally. Includes removal and inspection of organs, toxicology tests, histopathological examination, sometimes radiology, postmortem CT. 5. Biopsy. Done during life, often early in the disease process. Timing may be urgent or scheduled depending on clinical condition. Autopsy. Performed after death, ideally within 24 to 48 hours to prevent decomposition. May be delayed in special circumstances, e.g. embalmed bodies. 6. Who performs it? Biopsy doctors who may perform biopsies include surgeons, dermatologists, radiologists, image-guided biopsies, gastroenterologists, endoscopic biopsies. Autopsy performed by pathologists, hospital autopsies, forensic pathologists, legal autopsies. 7. Techniques used. Biopsy. Different types include needle biopsy, fine needle aspiration or core needle, punch biopsy, skin, excisional biopsy, remove entire lesion, incisional biopsy, remove part of a lesion, endoscopic biopsy, via endoscope. Autopsy procedures include external body inspection, Y-shaped incision on torso, removal and dissection of organs, microscopic tissue analysis, toxicology, blood, urine, stomach contents, photography, fingerprinting in forensic cases. 8. Outcome. Biopsy results provide confirmation of disease, type and grade of cancer, presence of infection or inflammation, guidance for treatment planning. Autopsy outcomes include exact cause and manner of death, confirmation of clinical diagnosis or uncovering missed conditions, information for family, genetic risks, legal evidence, homicide, poisoning. 9. Consent. Biopsy requires informed consent from the patient. Patient must understand risks and benefits. Autopsy requires consent from next of kin unless mandated by law. Medical legal autopsies never require family consent, e.g. murder, suspicious death. 10. Pain, sensation. Biopsy involves pain or discomfort. Local or general anesthesia is used depending on the procedure. Autopsy, no pain, body is non-living. Instruments can be used freely without concern for sensation. 11. Risks. Biopsy, potential risks to the living patient, bleeding, infection, bruising, damage to surrounding structures, rare. Autopsy risks relate primarily to healthcare workers, exposure to infectious agents, needle stick injuries, handling decomposed bodies. There are no medical risks to the deceased person. 12. Use in law. Biopsy, rarely used in legal procedures. Could be used to document workplace injuries, poisoning, etc., but uncommon. Autopsy, frequently used in criminal investigations, insurance claims, accidental deaths, medical negligence cases. Forensic autopsies play a crucial role in the justice system. Thank you. Have a wonderful day.